Chidinma is from Ebonyi State College of Health Science and Technology, Mbo. Okay, she has a lot of experience to share with us. She said, during my clinical posting at a primary health care center, I conducted health screening for 30 community members. Despite the limited resources, I learned how to develop stronger communication skills. I faced a lot of challenges in patient education, though it wasn't easy, but I overcame through creative strategies. I volunteered at local health fair, providing health education. It was a memorable moment when a patient thanked me for helping her understand her diagnosis. Wow, this is a good one coming from Chidinma from Ebonyi State College of Health Science and Technology, Mbo. Another person is Ibekwe Miracle Olebube. She is from Laxbury College of Health Technology, Ogidi. She has lots of experience to share with us. She said, during my clinical posting, I learned a lot about being a community health practitioner. At first, I felt nervous because I didn't know what to expect. One big obstacle was talking to patients. I worried that I might not understand their problems or that they wouldn't understand me. But with practice, I got better at listening and communicating. Additionally, language barrier with some patients presented a challenge, which highlights the importance of effective communication in healthcare. However, we are faced with lots of limited resources and equipment. This required a creative problem solving. I learned how important it is to build trust with patients. When they feel comfortable, according to her, they share more about their health. I also have learned about teamwork and how essential it is. Working with doctors, nurses, and all health workers helped us provide better care. We all had different skills, and together we made a difference. This is coming from Ibekwe Miracle Olebechukwu from Lansbury College of Health Technology, Okigi in Anambra State. And she went forward to tell us a story. So one patient, Mrs. Ekes, struggled to manage her diabetes due to limited access to healthcare. Through regular checkups and health education, I empowered her to take ownership of her health. Witnessing her transformation from frustration to confidence was a pivotal reminder of the power of community health work. This experience solidified my passion for community health and inspired me to continue making a difference in the lives of individuals and communities. In conclusion, my clinical posting experience has been transformative, equipping me with practical skills, empathy, and a deeper understanding of community health. I am committed to applying these insights to addressing health disparities, improving community well-being, and making a difference in the lives of individuals and community. That's from Ibekwe Miracle Olebube Chukwu from Lansbury College of Health Science and Technology, Okide in Anambra State. This one is coming from Mbamara Precious Pinazegbere from School of Health Technology, Okporo, all in Imo State. According to her, her experience is mainly on circumcision. She said that circumcision is a procedure that removes the foreskin from the human penis. And she went forward to let us know that we have two types of circumcision, the plausible and known as the ring method, and the classical circumcision. She went forward to let us know the advantages of both methods. She said personal hygiene is maintained in the ring method, no bleeding. But however, there's a disadvantage of classical circumcision. She said that there is a presence of bleeding, low level of personal hygiene, and all of that. She went on to let us know that a lot of challenges are the sport of dropping out, but I thank God. Okay, she said at a point, I wanted to drop out. But thank God I didn't because I am beginning to enjoy community health as a whole. Haven't contributed a lot to my community, but I have done little community practice like checking of vital signs. Okay, she said, I haven't contributed a lot to my community, but I have done little community practices like checking of vital signs, sharing of vitamin A, and albendazole during community immunization and vaccination. He wants us to thank her matron Onyinyechi, sorry, who took her time at the hospital to teach her and impart some knowledge to her, and also her fellow students. She said it was a really a welcome moment at Van Dam Specialist Hospital in Owerri. This is coming from Mbamara Precious Chinasepre from School of Health Technology Okoro in Imo State. She shared her experience about circumcision and have thanked persons who contributed this in her life as she embarked on practical experience. This one is coming from David Ndidi B. I assume that B could be blessing, right? She is from David's Maxine College of Health or Bukba in Soka in Enugu State. She has a lot of experience to share with us. She said, during my clinical posting, I learned the importance of total patient care and cultural sensitivity. Wow. Engaging with diverse population, improved my interpersonal skills, and deepened my understanding on the community health needs after I listened to their felt needs. Wow. I also okay. According to her, she said, I also enhanced my ability to think critically and respond swiftly in emergency situations. In my clinical experience, I found out that balancing limited resources while ensuring quality care was a top priority and a recurring challenge. I had to develop resourcefulness, making the most of available supplies and resources while maintaining patient care and standard. Another challenge was overcoming language barrier, which I managed by learning basic phrases in local dialects to communicate more effectively and with patients, especially the elderly patients and clients. She said, I was also among a team that organized health education section, focusing on maternal and child health, hygiene, and nutrition. These programs reached underserved communities and empowered individuals to take preventive health measures. We also partnered with local leaders to advocate for better health facilities. A significant moment came when a community member, after attending our hygiene education session, shared how our advice helped her to prevent family illness outbreak. Seeing firsthand how knowledge can transform lives was incredibly rewarding. My most impactful achievement was organizing a free medical camp that served over 50 individuals, provided screening and consultations, which garnered local recognition and strengthened community trust. I also witnessed shoulder dystocia, and it was managed successfully, and both the mother and child was fine with no complications. This is coming from David B. from Davis Mountain College of Health Technology or Bupa and Soka in Enugu State. That was a very wonderful one from David Ndidi Blessing from Davis Mountain College of Health or Bupa and Soka in Enugu State. Now, I think this is the last contestant to this competition. So, whoever you think that the experience entices you or you want to go to the comment section, comment the person's name, and as often as possible, because this competition, it's the judgment is based on numeric strength, and the numeric strength is determined by the number of times the person's name is being commented with other phrases associated to the comment. Thank you, and all the best.